Welcome back, everyone. April is Parkinson's Awareness Month, and doctors at UConn Health are really doing groundbreaking procedures to treat patients who have this disease.
Melissa Cole visited UConn Health's Brain and Spine Institute to learn more. Check it out.
Neurologist Dr. Nia Prakash specializes in neurodegenerative disorders like Parkinson's at UConn Health.
It's a gradually progressive disease, and usually people present with plethora of symptoms. The most common one are the motor symptoms, which is predominantly the slowness or paucity of movement. Some people can have abnormal movements like tremors and stiffness or walking difficulty. But along with these motor symptoms, they also develop other type of symptoms affecting different systems of the body. Those are called as non-motor symptoms, and they can be different for different people.
Depression and anxiety, difficulty sleeping, and even memory changes are other symptoms.
Parkinson's, we call it as an old age disease. Every one of us has risk of developing Parkinson's beyond the age of 60, and every decade our risk of developing Parkinson's increases.
The exact cause of Parkinson's isn't known, and there's currently not a cure. But here at UConn Health, there is a whole team in place to treat patients and help them manage symptoms and improve quality of life.
So the focus of treatment is using different treatment options and different combinations. The mainstay is, of course, symptomatic treatment with medication that try to improve the dopamine level in your brain. But along with medications, we would utilize rehab, which is physical therapy, occupational therapy, and speech therapy, using supportive treatment, whether depending on their ability, we can provide that at home or bring them to another facility, see what their needs are at that time in their life, and provide that. And with time, as the disease progresses, their needs are going to change. So the treatment options will be tailored to their needs at that point of time.
Neurosurgeon Dr. Christopher Connor tells us about another treatment option, deep brain stimulation.
I got recruited to come down to the University of Connecticut to start a program in a kind of therapy called deep brain stimulation, which is a therapy that's been around for a while, but involves a surgery to actually treat a lot of the symptoms that patients with Parkinson's suffer from.
So what does it really entail?
That's a good question. So deep brain stimulation is very similar to like a pacemaker, whereas a pacemaker gets put in the heart though, deep brain stimulation is a way of putting wires and a battery into the patient's body so that we can actually stimulate the brain itself. And so the surgery involves a couple different steps. The first step actually is a brain surgery where we drill 2 holes on the top of your head, and then we insert wires about 6 centimeters into the brain, depending on where we're going, in order to chronically and continuously deliver electrical stimulation to, again, treat some of the symptoms that patients with Parkinson's have.
In this video, Dr. Connor is performing this surgery on a patient who was diagnosed on the younger side, in his 40s. This procedure is extremely successful for the right candidate.
It's upwards of 90% successful at giving patients a really significant improvement in their symptoms and their quality of life. Patients with Parkinson's have a whole different set of symptoms. That includes tremor, it includes slowness, it includes rigidity. Now, deep brain stimulation is great because it can actually address all of these different symptoms. Now, some of those are easier to address than others. By far, the easiest one for us to address really is the tremor. But over time, as we adjust and optimize the stimulation that the system is actually giving to a patient, we can, in fact, treat most of the symptoms of Parkinson's disease.
About 3 months after the surgery is when patients really feel and see the benefits.
The other thing I get asked pretty often is, well, is there an age cutoff? And honestly, there's not really an upper age cutoff for this. I've operated on and I've done surgery on patients who were in their 80s. And someone in their 80s might look, they might look great and they can get a lot of benefit out of it. And so that is not something that really deterred us all that much. A good patient for DBS is a good patient.
I think that the most important message that needs to go out to the patients is being aware of their symptoms, having the right team by your side, and being and participating in their own care, right? So at least the way we see it, it's not about us telling them that this is what you need to do. It's about creating that environment where people feel empowered to take their health in their own hands and take the right decision. So we are only here to guide them.
All right, for more information about the Brain and Spine Institute at UConn Health or to schedule an appointment, you can visit health.uconn.edu.
All right, Kara, let's switch topics a little bit now.